states that are on the list for the worst health outcomes and the worst maternal health outcomes are challenging these laws. It is time for us as a country to really evaluate the purpose or intention behind the policies that we implement. If you truly are implementing restrictive laws so that you can save the lives of children, what happens when you realize that you're not really saving the lives of the children, but you've made it actually worse? Or have we systemically implemented policies that have worsened maternal health outcomes because the underlying goal is to worsen the outcomes and survival rates of the marginalized community that are the most impacted by these same policies? As an executive order, will we see a continuation of the Women's Health Research Initiative, or in the years to come, will we see a regression in the progress that has been made in women's health? Do you know which pregnancy-related policies or executive orders, laws, or special programs? Do you know which women's health initiatives may be canceled? Today, we talk women's health policies and provide actionable steps you can take to continue to move the needle forward in improving areas, especially maternal health care in the United States. We thank you guys for watching, and as always, don't forget to do it. Hit subscribe. So many of you are wondering, with the upcoming changes, what can you anticipate happening to women's health? What changes are going to be reverted back, and what new changes we can anticipate? Well, regardless of your political alliances, it's important that we all stay focused on what happens with women's health, as usually it's the marker not just for women's health, but also for other groups that have been underrepresented in medicine, especially when it comes to medical research. One thing we can be sure of is that maternal mental health and maternal health as a whole remains a crisis in the United States. And so any changes that the next administration does will be critical as to whether or not we will continue to see rising numbers of maternal mortality, or whether we will start to eventually improve and address this crisis. Now, one thing we can assure ourselves is with every administration, there are changes, and some of these changes will directly impact our lives on a day-to-day. One of the areas of health that warrants our continued attention is the maternal mortality crisis in the U.S. Any changes that the next administration does will either set us back or propel us forward in finally combating this issue. Now, many are disheartened and feeling hopeless, given all the other issues that we have experienced in the last couple of years when it comes to certain states and policies regarding maternal health care. Well, if we use the past couple of years as a barometer, statistically, we would expect that it would continue to worsen. Today, we're going to lean into some of the legislation regarding maternal health that you should be aware of, where we've been and where we are now. So some people are alarmed by the possibility of a certain individual being the secretary of the HHS. So why is this so alarming to individuals? Beyond just his theories and belief systems, it's really just looking at the power of the HHS, which, for those who don't know, is the Department of Health and Human Services. So the HHS is probably one of the most powerful federal agencies, and it has 13 operating divisions, including 10 agencies in the U.S. Public Health Service and 3 in Human Services. So what of some of these divisions? Well, the HSS Chief Policy Officer and General Manager, administrators, and overseers are the ones who are responsible for our day-to-day health policies and our management of human services. So this includes the Administration for Children and Families, that's the ACF, also the Administration for Community Living, Advanced Research Projects Agency for Health, Administration for Strategic Preparedness and Response. So that's the nation's leading medical and public health preparedness division that helps us to recover from disasters and public health emergencies. There is also the Agency for Health Research and Quality. So the agency that really looks at the data to determine how or what policies will help us to improve our health outcomes. There's also the Assistant Secretary for Technology Policy, Office of the National Coordinator for Health Information Technology, the Agency for Toxic Substances and Disease Registry, so helping us to continue to monitor exposure to toxic substances and to monitor their adverse health outcomes and come up with policies that will help to minimize risk or adverse health outcomes with regards to exposure from these toxic substances. The Assistant Secretary for Administration, the Assistant Secretary for Financial Resources, Assistant Secretary for Health, Assistant Secretary for Legislation, Assistant Secretary for Planning and Evaluation. So this essentially is the individual that advises on policy development and contributes to policy coordination, legislation development, strategic planning, policy research, evaluation, and economic analysis. There's also the Assistant Secretary for Public Affairs, the Center for Faith-Based and Neighborhood Partnerships, the Centers for Disease Control and Prevention, an operating division that we are all very familiar with. And we're also very familiar with the Centers for Medicare and Medicaid Services. That's pretty self-explanatory, but we're going to go into some of the policies specific to Medicaid in a little bit. Departmental Appeals Board, our Food and Drug Administration, HRSA, which is the Health Resources and Services Administration. It is under HRSA that we have our community health clinics. So the funding for community health clinics that provide health services to underserved, marginalized community comes through HRSA, and HRSA is also the division that monitors the efficacy and the outcomes that these clinics are having on our health population to make sure that we're making the right decisions and we're truly making an impact with the funding that's provided. Then we have the immediate office of secretary, the Indian Health Service, which is very important to our American Indians and Alaskan Natives populations in organizing comprehensive health services and developing and managing programs that meet their specific needs. We also have the NIH, which is your National Institutes of Health, and this is basically the core of our research. Then you have the Office of Civil Rights. Some people aren't aware that the Office of Civil Rights is actually under the HHS, nor are they familiar with the fact that the Office of Global Affairs is under the HHS, that the Office of Inspector General is under the HHS, that the Office of Intergovernmental and External Affairs, as well as the Office of Medicare Hearings and Appeals, the Office of General Counsel, SAMHSA, which is our Substance Abuse and Mental Health Services Administration, is under the HHS. So now that we have a clearer idea of what the HHS is and what their responsibilities are, now it may be a lot clearer to you as to why some people are very concerned about who becomes the secretary of the HHS. So one of the divisions that I mentioned was the Centers for Medicare and Medicaid. That particular sector is really important. We're going to get into some of the health policies that are most critical in our recent years that came out of the CMS. So the CMS has recently been tasked with negotiating pharmaceutical prices for certain drugs that are commonly used in our populations. Most successfully, they have reduced the price that individuals who are affected by diabetes have to pay for their insulin. So it's a very impactful operating division. Another important milestone that's been accomplished by the CMS is the extension of postpartum care coverage under Medicaid. So previously, postpartum coverage was limited to 60 days, but now that coverage has been extended to a year, and all states are eligible to participate in the extension of the postpartum services. So one of the things I will mention today are policies that are signed into law and policies that are executive action. And that will give you a clear idea as to which things are most likely to be vulnerable to potential changes. So as of April 1st, 2022, the postpartum coverage was extended under Medicaid as a part of the American Rescue Act plan. So that was a law. This included initially a temporary state option to extend continuous Medicaid and CHIP eligibility for pregnant individuals from 60 days to 12 months. And then the Consolidated Appropriations Act that was signed in 2023 made the state option permanent. As of yet, not all states have adopted or utilized this extension. As of April of last year, only 31 states had enacted extension of the postpartum coverage, not and the District of Columbia. It is also no surprise that unfortunately the states that have not extended the Medicaid postpartum coverage are also states that are challenged with the highest rates of maternal mortality. Nearly two-thirds of Black individuals are more likely to give birth under Medicaid coverage. So the impact of Medicaid coverage is critical to our populations. Also, keep in mind that the extension of Medicaid coverage allows us to better impact the fact that the postpartum period has the highest, more than half of maternal mortality cases occur in the postpartum period. So the postpartum period is the most critical period to impact the outcomes when it comes to maternal mortality. For example, patients who are impacted by mood disorders, as we all have learned, mood disorders don't just suddenly disappear at the 60-day mark. Many people are impacted by postpartum depression and anxiety symptoms far beyond 60 days, well into a year, and some even beyond that. And so having adequate coverage to address these issues is really critical. It's also important to start to even increase our acknowledgement that pregnancy has long-term impacts on the body far beyond 60 days. Those who have been impacted by musculoskeletal issues, whether it's chronic lower back pain, whether it's pelvic instability, can definitely tell you that these issues don't resolve in 60 days. Also, those who have been affected by stress incontinence and other types of pelvic floor dysfunction will tell you that their chronic pain or their chronic incontinence issues are well beyond 60 days. So in order to appropriately impact these areas of health, it's really important to have the coverage for our most marginalized communities that depend on Medicaid for coverage. Similarly to the Affordable Care Act, which is also Obamacare, I'm going to repeat that. The Affordable Care Act is the same as Obamacare. They're not different. Can we all agree and understanding that it's the same program? And so, similarly to the extended care for postpartum patients under Medicaid, the Affordable Care Act has not been equally accepted amongst all states. In fact, there are still about 10 states that have not opted to expand Medicaid services for patients who qualify. So, what is the Affordable Care Act? The Affordable Care Act is a federal state program that provides health care to low income individuals. And this was enacted in 2010. It is a law. So what are the states that did not expand coverage? Well, that include Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming. So what happens when states don't incorporate the Affordable Care Act? Well, it leads to a coverage gap. So what do I mean? Well, Medicaid will cover those that fall within the poverty parameters for Medicaid, so the lowest income individuals in the United States. But then we develop what's called a coverage gap. There are individuals who don't fall within those low measures, but who can't afford the high premiums of insurance plans. And so they fall into what we consider a care gap. This is critically important because medical debt is oftentimes one of the top causes why individuals develop or have to go into bankruptcy. So medical debt is really important, and having access to affordable healthcare is crucial for individuals. Those who don't have access to affordable healthcare are more likely to have delayed diagnosis, higher adverse outcomes, lower survival rates when it comes to conditions like cancer. They're more likely to have more complicated outcomes, and they're more likely to not take medications as recommended to help their health outcomes, oftentimes portioning their medications due to their inability to afford them. So when we look at, well, what does it mean? What is the practical outcome of this? Well, one of the things we should keep in mind is, well, what does it mean in terms of What are the states that have the highest maternal mortality rate? Because if you have states that haven't adopted the extension of the Affordable Care Act, then you will have women who will fall within this coverage gap. And the states that have some of the highest maternal mortality rates include South Carolina, Tennessee, Texas, Alabama, and Mississippi. The same category of state, the same group of states that's also on the list for some of the poorest overall health outcomes in the United States. And so, what are the states that not only have the poorest maternal health outcomes, but also have some of the highest number of Black moms? Well, these states include Mississippi, Louisiana, Georgia, Alabama, North Carolina, Virginia. So again, there is overlap between the coverage and access to healthcare and health outcomes. According to the World Population Review, the states with the unhealthiest populations include Louisiana, Alabama, West Virginia, Kentucky, Arkansas, South Carolina, Oklahoma, and Mississippi. You're seeing the trend here. And according to the Commonwealth Fund, the states that rank lowest when it comes to health outcomes include Arkansas, Texas, Oklahoma, West Virginia, and Mississippi. So again, there are consistencies between the access to affordable health care and the health outcomes, not just in maternal health, but overall health outcomes for the population as a whole. So on that note, let's talk about the Momnibus Act. The Momnibus Act is important to know because it is directly targeting ways in which we can address social determinants of health that can improve our maternal health outcome. It includes 13 individual bills that will invest in these particular areas. For example, these areas include transportation, housing, and nutrition, some of the very well-known social determinants of health, meaning that these particular areas have direct impact on our maternal health outcomes. So if we improve these particular issues by improving access to proper transportation, improving access to nutrition, improving access to affordable, safe housing, then it's very likely we can have great impact on reducing the maternal mortality rate in the US. This is a law that has yet to be signed, so it warrants our attention. So what are some of the examples of the bills? Well, it includes the extending WIC for New Mom Act. What is that? So it extends WIC services, which helps to improve nutrition of our new moms so that they have access to these services for more than the current cutoff. So for example, WIC services currently end for postpartum individuals at 6 months. This particular act will extend the access to nutritional foods to 24 months. Similarly, for breastfeeding moms, the current WIC eligibility ends within 12 months. This particular bill would extend their eligibility to 24 months. Very critical period when it comes to health outcomes in infants and toddlers. This particular extension of the WIC eligibility for New Moms Act was penned by Representative Lucy McBath and Senator Richard Blumenthal. The Momnibus Act also does several other amazing things. Some of my favorite parts of the bills, and granted, all of the bills are warranted and definitely are really good ways or strategic ways of improving maternal health outcomes, but there are some that really stand out to me, and one of those is funding for community-based organizations that are working to improve maternal health outcomes. Clearly, Healthy Bum Club, need I say more? Also increasing fundings to improve maternal health outcomes amongst our veterans. I mean, that goes without saying, right? We must support our veterans. And then you have the goal of increasing diversification amongst the perinatal workforce. Need I say more? Healthy Bump Club. Okay. And then also improving data collection and processing of this data so that we have quality measures. This is very critical because one of the things that's really important to improving any outcomes is that you're able to assess the data to know how to strategically address those issues or problem areas, and then be able to monitor your outcomes for your strategies so that you basically know that the policies that you've implemented are actually working. And I'll give you an example of this in a few moments. So also there amongst the bills are strategic initiatives to improve health outcomes for incarcerated women. I mean, women who are not incarcerated are having a hard time having great access to quality maternal health care. Need I say more about the women who are incarcerated? and how our incarcerated population is treated, there are certain things that are just basic rights. If we're truly determined to impact the life of all children in the United States, then that includes children of incarcerated moms. The Momnibus Act also targets improving services for women who are affected by mental health conditions, as well as those who are affected by substance abuse. We've mentioned on this platform before that that is currently the number one cause of maternal mortality outcomes in the United States. So it's really important that we continue to put an effort into funding areas that help to improve the outcome specifically for moms with mental health conditions, as well as moms who are affected by substance abuse. And then it includes areas that are concerning for a lot of us, climate change. So amongst the bills of the Momnibus Act is a bill that targets improving and addressing the risk of moms and infants who are affected by climate change disasters. So this bill or this Momnibus Act just seems like a no-brainer. And you could go on the website to see the long list of organizations that are championing behind this bill. We have yet to get this bill passed. And some would argue that perhaps some of the resistance is that people don't truly want to improve maternal health outcomes because they don't truly want to improve Black maternal health outcomes. And we can talk about that in a few moments. So talking about maternal mental health, one of the amazing accomplishments recently was the start of the Maternal Mental Health Hotline. And that is just amazing that we have a national hotline that women all over this country can call. Because as we have mentioned before, we have been underserving women who are affected by postpartum mood disorders and psychoses. So having additional resource to combat and to address these issues is extremely important, but it's specifically also addressing some of the disparities when it comes to Black maternal health, because we know studies have shown over and over that Black moms are less likely to have access to maternal mental health services. So here is a hotline that then increases their ability to have access. However, one of the things we have to keep in mind is that this is a funded program, meaning it's not an executive order, and it is certainly not a law, which means this is a vulnerable area that if another administration comes in, they can eliminate. The other thing that was also an amazing milestone in the area of hotlines is the National Suicide Hotline number, which is 988. Amazing. So not having to remember a long extended number makes it so much easier so that those who are in the midst of a crisis can pick up the phone and dial a simple 988 to receive help. Now, this was a part of the National Suicide Hotline Designation Act, so it is a law that was signed in 2020. Again, the National Maternal Mental Health Hotline is not a law, unlike the National Suicide Hotline Designation Act of 2020. Another advancement of maternal health services in the recent years is the new designation under CMS of birth-friendly hospitals. So what this does, it created a criteria for hospitals or measures for hospitals to meet certain benchmarks in order to be qualified as a birth-friendly hospital. And what this does, it gives birthing individuals the ability to have access to know what hospitals have higher quality maternal health services. This, however, is a designation program under CMS. So it's a CMS program, which means if someone else comes in and decides to change the policy, they can easily rid this particular designation. Again, the birth-friendly hospital designation can be vulnerable if another administration comes in, the next one, or in the future. What is another law that was another major milestone in the United States in the recent year? The Pregnancy Workers Fairness Act. Oh my gosh, this is one of my favorite laws. And it's one of my favorite laws because it empowers women and birthing individuals to be able to request very basic, reasonable accommodations from their employer. There is an exception for employers who have a certain size of a business. For the average employer in the United States, this law empowers their workers for birthing individuals to be able to just have reasonable, we're not talking about extenuating circumstances. We're talking about very reasonable accommodations. So what are some reasonable accommodations? Well, some of these will surprise you. Not all birthing individuals have access to bathroom privileges or have access to be able to sit intermittently depending on what their occupation is. Some birthing individuals don't have the ability to hydrate throughout the day. So if you have a birthing individual who's an outdoor construction worker, guess what? They may be vulnerable to the conditions of their job just simply because they don't have reasonable accommodations. Individuals who have to walk far distances for their jobs. So this act allows them to request the ability to park closer. Could you imagine working for a job that requires you to wear a uniform, but then doesn't accommodate your growing uterus, your growing belly when you're pregnant? This does happen. So this law allows birthing individuals to request the adjustment or uniforms that actually fit their growing bellies. So when we talk about individuals and their ability to change their hours so that they're able to go to the doctor, being able to have access to go to their doctor's visits, these are reasonable requests. The ability to have a chair that is comfortable to sit in while they are doing their prolonged computer work. Again, we're talking about reasonable accommodations. This is just basic humanity, you guys. The fact that this had to be signed into law, and it was signed into law in June 2023. But the fact that it even had to be law just for birthing individuals to have reasonable accommodations, that is basically the humane things to do, is so sad. And it says so much for our society and how much further we need to go. But this law was not passed without challenges. There were several states, in fact, 17 states to be specific, that actually challenged this particular law from being passed, from its final ruling. And they actually collectively sued the U.S. Equal Employment Opportunity Commission, EEOC, to block the final rule to implement this law. And so what are those states? We're going to call out these states, you guys. So these states that challenged the implementation of the Pregnancy Workers Fairness Act includes Alabama, Florida, Georgia, Idaho, Indiana, Iowa, Kansas, Missouri, Nebraska, North and South Dakota, Oklahoma, South Carolina, Utah, and West Virginia. And the lawsuit was led by Tennessee and Arkansas. We're calling all of you guys up to the front of the class. The law was passed on June 27, 2023, but the challenge against this law has not ended. In fact, Texas is currently challenging the implementation of the law, and the process in which the law was passed is being challenged by Texas. Mind you, Texas is the state with, never mind, we'll talk about that in a few moments. Also, two other states that have been challenging the Pregnancy Workers Fairness Act include Tennessee and Louisiana. No surprise. Again, states that are on the list for the worst health outcomes and the worst maternal health outcomes are challenging these laws. Do we not see consistency here between the states that challenge particular laws and the states that have the worst outcomes? Why don't they see this, you guys? Why don't they see? Again, it may come back to what we're going to talk about in a few minutes, is what is the motivation behind this all? So let's talk about Texas. Texas like to be in the front of the class so often when it comes to maternal health care. Texas, we're going to use you as an example. There have been lots of controversy since the passing of the Dobbs decision, and Texas has been central in implementing laws that have been restricting AB services, so abortions services. Now, one of the things I do want to touch on is just the continued effort to lump all abortions into the same category. And so there are states currently that don't even make accommodations for women who are having outcomes that are beyond their control. So women who are experiencing what we call spontaneous or demised abortions, or ABs, we're going to say from now on, have not made any accommodations for women who are experiencing these types of abortions. Instead, they're blanketly using the word abortions or ABs to include those that are out of the control of the pregnant individuals and those that are elective decision, which again may not necessarily imply full control in individuals who are pregnant. There is a difference between types of abortions. So ABs, there are three primary categories. You have your spontaneous ABs, which also include your blighted ovums, your demised ABs, meaning someone went to the doctor, was diagnosed with an unalive pregnancy. And so they have a pregnancy loss that has not expelled. Those are the women who are getting caught up in the controversy of what we call elective ABs. Elective ABs are individuals who are pregnant and for whatever reason, and there are a myriad of reasons, which includes incest, which includes assaults, assaults, are apes. And so they elect to complete their pregnancies via an AB. These are not the same group of women. They're very different circumstances. And then you have individuals who will see on their chart that they have a threatened AB. A threatened AB means someone may be having bleeding, may have bleeding with or without cramping. That implies there's a potential that they may have a spontaneous AB, otherwise known as a miscarriage. And that individual has the potential of miscarrying at some point in the near future, or may go on to have a completely normal pregnancy. But until further information is known or time has passed, they're considered to be a threatened AB, meaning we have identified that the pregnancy is alive, but there are circumstances that increase the likelihood that it may not survive. Are certain symptoms that indicate that an increased likelihood that the pregnancy may not survive. What legislatures have done and politicians have done, which is why it's so important to pay attention to judges on local, state, and federal levels, because they're the ones that are making these major life decisions. And what they have ultimately done in certain states is they have fused together all of these categories, and making it very difficult in certain circumstances for women or pregnant individuals to receive care unless they are at death's door. Now, who determines that someone is at death's door? Only the good Lord knows who's at death's door. But they have placed in the hands of physician this ominous responsibility of making that determination. And then and only then can pregnant individuals receive care. The logic behind this is that these states have said that they do not want to, for religious reasons, support the elective ABs. So because they are pro-life. And so let's look at, well, is it actually working? And has it historically worked to have these restrictive laws? Because if you're looking, when we talked about the division of the HHS that look at the quality measures and outcomes, this is why that's important, because you can implement policy because you feel so passionate and so compelled to do so, but it doesn't necessarily mean your policy leads to the outcomes you're looking at. And if you truly are interested in the outcome, in the particular outcome, then you would assess your policy if you're not getting the outcomes you're looking for. So what has happened in states like Texas, and Texas we're focusing on because there was actually a JAMA report that said between the year of 2021 and 2022, the infant deaths in Texas, subsequent to the more restrictive laws, have increased from 1,985 to 2,240 cases. which is a 12.9% increase compared to the rest of the United States, which is 1.8% on average. This is not new. We've known this about these restrictive laws when it comes to teen pregnancy. Teen pregnancy has always been higher in states that actually have more restrictive laws, which means these laws don't work. They don't even get the outcomes that they're looking for. And this is not new because historically, states with the highest ban had a 16% increase infant mortality rate between the years of 2014 and 2018. Again, I'll repeat that. States with the highest ban had a 16% increase in infant mortality rate between the years of 2014 and 2018. So even if you don't care about the outcomes of women, if you truly are implementing restrictive laws so that you can save the lives of children, what happens when you realize that you're not really saving the lives of the children, but you've made it actually worse? And what I'm going to end by saying is, it is time for us as a country to really evaluate the purpose or intention behind the policies that we implement. Because truly, if our policies is to improve the lives of women and children, then there are multiple areas that continue to be lacking attention and implementation. And there seemed to be a very tunnel vision approach to doing so. It challenges us to really understand whether or not is the effort truly to improve the maternal health outcomes, or is there an underlying intention that since the maternal health outcomes adversely affect certain populations, specifically Black women, that this may in fact not be an intention to save women, but an intention to continue the systemic harming of a certain group of women. And everyone else is collateral damage. So I'm going to leave you to think about that because the proof is in the pudding. The proof is in the stats and the outcomes. The policies that have been implemented to be more restrictive have actually worsened the outcomes in the same states. So we need to start really thinking about what truly is our intention as a country. Is our intention to truly improve maternal health outcomes for all women? Is our intention to truly improve infant health outcome for all infants? Or is this a vehicle of systemic oppression that continues to marginalize and adversely affect the outcomes of certain populations? That's all I'm saying. You be the judge of it. And here are 3 actionable items for you. 1, stay informed. 2, hold your congressmen and women accountable. And 3, figure out ways in which you can make differences for the care gaps that may happen if new policies arise. This is Dr. T, the hand behind the handle of Healthy Bump Club right here on YouTube and Healthy Bump Club on Instagram. And don't forget that we're also on Fanbase. We thank you guys for watching. We thank you for having these critical conversations together. This is a community, a safe space for all to have these discussions. And so we thank you guys for listening. We thank you for being a part of our community. And we thank you for continuing to contribute, whether it's through your viewership, your likes, your commenting, to propel this information forward so that those who most need this information will more likely have access to it. Our information that we share here is not just applicable to the United States, but also applicable to countries around this entire world. We thank you for joining us, and we hope to see you guys when? The next episode. Don't forget to comment, like, and share.